Good evening, everyone. My name is Dr. Okobi. Um, I'm the founder of the Global Research Initiative. The Global Research Initiative is an initiative that focuses on how to train younger physicians into understanding the concept of clinical research, how to apply clinical research to their everyday medical practice, how to write clinical research papers, how to, utilize data and information clinically to help improve patient care. Not just only to help improve patient care, but also to, help add knowledge to the already existing body of knowledge. We've had several lectures or several short series on how to, understand different methodologies. Today we're continuing our series on how to write the discussion segment of the research paper. We gave an overview in our previous video of what the discussion segment of a research paper should look like. Today we're just going to the structure, the nitty-gritties of each discussion paragraph. So we'll be focusing in one of the most critical skills or critical skills, in opening paragraph of the discussion, right? Um, in context, I'm going to use one of the studies that we did um, way some back that looked at the association between hemoglobin A1C level, antidepressant use in adults who have both type 1 and type 2 diabetes. And the objective of that paper was to determine whether antidepressant use was significantly affects long-term blood sugar control or measured by sugar control measured by A1C. That was the objective of our paper. It was a retrospective paper, so we're not going to attribute causality or significant causality to it. It's just an observational what we observed using a large data sample set. So once you have your objective in mind, and then you also have your paper in mind and your objective or your hypothesis or what you want to discuss, the first step in the opening paragraph of your discussion segment should always highlight the key results. That's our recommendation, right? For this study, for example, the study I just mentioned, we wrote something like, in this nationally representative sample, antidepressant use was not significantly associated with hemoglobin A1C levels in adults with type 2 diabetes and depression, right? So we set like a clear tone. That opening statement, we actually got it from our major finding in the results. So we recommend that if you want to do an opening statement, look for your major finding in your results and then state it like opening. You can also have two or three findings. You can also add them one, two. So you can use conjunctions or transition phrases like additionally, secondly, and rest. The next step in your discussion segment in that first paragraph is to put a second statement. Second statement, usually in this context, in the first paragraph, should restate, context, not restate, contextualize. Okay, why did you do this? What are you doing? Right? Why did you go into this type of studies? It's not like an objective, but you're just kind of contextualizing it with literature, with previously existing data or previously existing studies or guidelines, right? That will help the reader to understand, okay, this is where this thing is going. This is the flow to it. So uh, I generally recommend to show how it compares with what others have found. For example, in our own paper, we started with, okay, this aligns with the earlier studies that reported little or no effect of antidepressant use in glycemic control, despite concerns about weight gain and glucose metabolism, right? So that's how we did it. This our statement shows the readers that we understand the broader context of what the whole discussion is about. You see how we said that this aligns with previous studies. If it contrasted with previous studies, we can also say this is in contrast to what previous studies have found. That's the broader context. Okay. Then you move to your third statement in your introductory paragraph. Your third statement is, okay, this research that you've done, how is it novel, right? What does it add to the existing literature? What does it bring uniquely to itself? Maybe it could be the data set, it could be the sample size, it could be the population you studied, it could be the demographic you studied, right? In our case, we use large data sets. So our statement will go like this. Unlike prior studies that focused on specific antidepressants, this research used enhanced data providing population level insights, right, across diverse demographic groups. So this is the value that we bring in larger data sets. Your own research could be on a different demographics or on a different population sample or different age group, or whatever it is, compared to what has already been previously done. Now, one statement, second statement, third statement. Now we go into like the closing statement for that particular paragraph one. And the closing statement is a statement that sets the tone for the remaining conversations in paragraph two, paragraph three, paragraph four, or depending on how many paragraphs you are deciding to discuss. And we usually say reserve each paragraph for the other findings. One paragraph for the first finding, second paragraph for the second finding, third paragraph for the third finding, and like that, or keep going in sequence. So in the closing paragraph, we do the what they call the the transitioning statement. For example, in our own case, we could say, or we said, these findings suggest that the relationship between antidepressants and glycemic control may be influenced by factors such as medication type, treatment duration, or behavioral patterns, which we discuss further below. And then we now go to the next paragraph, right? So remember, this is a very simple formula. State your finding, contextualize it, write its novelty, and then transition to the other things. If you keep this formula very simple like this, you find it so easy to write any discussion segments, especially the introductory paragraph. In our subsequent videos, we're going to talk about the other paragraphs and how to, you know, view it in view or in lieu with your resource section, and then your analytically breaking it down and explaining it, what it means, why you found it, how it compares to other existing literature, and then the implication. At the end of the day, don't forget the other technicalities about writing a research paper, like adding citations and references, which we have already talked about. If you did a video on that, transitioning phrases like furthermore, in addition, likewise, similarly, in contrast, right? Those transition words, and then um, you know, putting the appropriate context in the right appropriate context. If you say figure one above, explain a little bit what figure one is, before you start going into the details of figure one. I hope this video was helpful. If it was, I know research is boring, but we'll try to make it as very simple as possible. Hit the like button, subscribe to our channel, share this with your colleagues. Let them know that, there's a group of physicians out there that's trying to figure out how to make research very comfortable, how to make understanding of research very comfortable, and hoping that we can improve the quality of health of our patients and eventually add to the body of knowledge with our voice and what we're doing. My name is Dr. Okobi. Thank you so much, and God bless.